Hello, everyone. Thank you for joining us and welcome to the Global Health Institute. Today's webinar is going to be about the role of telemedicine and augmented reality in the management of war wounds, delivered by Dr. Nadine Hashash. Dr. Nadine, thank you for joining us.
Thank you.
It's a pleasure to have you. My name is Nasreen Al-Hadi and I will be hosting you today. Currently, I am managing the Academy Division, which is our capacity building arm of the Global Health Institute. So to tell you a bit more about Dr. Hashash, Dr. Hashash is the CEO and founder of Proximi. She's a consultant and a plastic surgeon and the director of clinical innovation and strategic partnership at St. Thomas NHS Foundation Trust in London, UK. Growing up in post-war Lebanon was a formative experience, shaping her future career not just as a surgeon, but also as an entrepreneur. Her initial motivation to help people grew into a wider goal to help bring safe surgery to the world. She created Proximi, which is a software platform that captures data and generates new insights to improve patient outcomes and OR productivity. Thank you, Doctor, for giving us of your time, and I will leave the floor to you. Thank you.
Thank you so much. Thank you for joining me today on the webinar. It's a pleasure to be here, and as always, a pleasure to support EUB. As Nasreen kindly introduced me, I'm Nadine Hashash. I'm a surgeon, and I'm an entrepreneur, a clinical entrepreneur. And so really what I wanted to start with is often when we talk about entrepreneurship and innovation, everyone has their why. And so I thought that the best thing for me to start with is to share my why with you as well. And for me, really, it started from my childhood. I was born in San Diego, but in the late 80s, early 90s, the family decided to move back to Lebanon. Lebanon was just emerging from its civil war, and everything was different. Everything that I had taken for granted as a child looked and seemed different. Even simple necessities like electricity, water. Again, what I'm describing, unfortunately, repeats itself, and you guys I'm assuming are a lot younger than me on the call, have gone and would have gone through this even just most recently. And so the scars of war were very visible. And I was 14, and I was very fortunate to accompany a family friend, a reconstructive surgeon, Dr. Kamal Abu Daher, who was doing reconstructive surgery on patients in the South. And I was able to see him reconstruct this young girl's foot. She had a scar contracture. She was carrying both physical and emotional scars of war that would shape her life. And he was able to do a simple procedure that enabled her to go back to walking and play with her friends in the streets. And it was clear to me then and there that I wanted to be a reconstructive surgeon. I wanted to restore form and function to improve people's quality of life. And I never looked back. Of course, there are many cases that I can think of and, you might have lived through that have influenced that, not least, of course, most recently with the pager blast, where I was able to come down and operate on patients as well. But I think what's really important is the realities that healthcare providers face in conflict zones, the destruction of infrastructure, the scarcity of medical professionals, barriers to access to medical care, funding challenges, equipment challenges. These, unfortunately, are not unique to Lebanon. They are all over the world. We see these challenges in that. And I think what's also quite important to recognize that, we have clear examples of where this impact has been realized. In Gaza, 90% of hospitals are non-functional, with only 16 partially operational. And frankly, this was of January 2025. This data is probably largely outdated already. In Ukraine, over 1,000 healthcare facilities were damaged in the first 2 years. In Ethiopia, 1,072 public healthcare facilities were destroyed, looted, or damaged. And so this is not to mention, of course, the ambulances that have been targeted with airstrikes, the emergency services. And again, we have seen what's even been happening in the news in the last few weeks of that visual of the ambulances being affected. We also know that it's not just about infrastructure, it's about people. And we know the number of healthcare workers we have lost in Gaza. We saw in 15,000 in Sudan. We've seen almost 95% of Aleppo's doctors were displaced or killed. And so this has profound impact on countries that is very, very, very hard to rebuild and very hard to recreate. And so it's really important to think about, when it comes to, healthcare, it's really a matter of survival. Severe shortages of medical supplies can affect and impact. Even when care exists, reaching it can become life-threatening in some cases. Patients with injuries trying to navigate bombed out roads to reach overcrowded clinics and injuries, chronic conditions that often get ignored in these environments, patients with diabetes, with renal disease, with others, with cancer, these can become issues as well. And these are things we experienced obviously firsthand, even more recently in our own country. War wounds in modern conflicts are characterized by severe trauma from explosive devices and blast injuries, chemical attacks, we know as well, but they have complexity as well. And we know that the blast injuries that are predominant in conflicts like Gaza and Syria can cause multi-organ damage, fractures, soft tissue loss, but they can result in long-term, lifelong changes. Extremity injury and amputation is a huge challenge, and we've seen that almost in 30 to 40% of cases in these environments, and amputation rates rising to almost 8% in vascular trauma cases. Beyond that, we also know that we have challenges around infection and antibiotic resistant. These are environments that are heavily contaminated with debris, with the agents, with whatever is in the ammunition as well. And so it's very quick to get multi-drug resistant Acinetobacter and other components as well. And so you need serial debridements to manage this necrotic tissue, which has a huge pressure on the limited constraints and the resources as well. And we know antibiotic scarcity, for example, in Gaza, only 38% of primary health centers had antibiotics, and they had exacerbating resistance as well. Now you move on to delayed or inadequate access to care, which is also coupled with resource constraints, which we see in these environments as well. Triaging challenges, specialized care gaps, thinking about patients who are amputees, for example, what is the post-amputation journey for them? Do they get a prosthesis? Do they not? Can they get the support they need or not? Phantom limb pain, nerve pain, et cetera, et cetera. And so we know, for example, in Ukraine, amputees face lifelong disabilities due to insufficient prosthetic services. So we know that there's a clear need around that. And we know that in these environments, a multidisciplinary approach can be hugely valuable. And maybe not having all the expertise on the ground, it's hard to have all the expertise on the ground, but to have those connected remotely and engaging actually can be really, really important as well. And when you're on the front line dealing with those complex cases, knowing you have an ally on your side can be hugely game-changing. And so telemedicine really has emerged as a lifeline in war zones, transforming how we connect, how we treat, and how we train local providers. It enables healthcare providers to consult, to diagnose, to treat patients remotely where crucial. For example, in Ukraine, they've done over 60,000 telehealth visits during the first 18 months of the conflict, reducing the need for risky travel to healthcare facilities. And we know that it's not just in surgery, but they can be helpful in radiology, dermatology, intensive care, and often in non-conflict zones, we see this available as well. And what it does is it ensures patients receive consistent care, essential in conflict zones where displacement and instability are very, very common. And the continuity is particularly important when you're managing chronic conditions like diabetes and hypertension as well. But let's take a step back and look at the history. People have always used telemedicine in war zones. It may not have taken the shape or form that it has now, but really what we mean is people have always found ways to communicate. Let's think back to the American Civil War in the 1800s, a time when the telegraph played the key role. It was the cutting-edge technology. It might seem far removed today from the telemedicine tools that we all have at our disposal, but it was about transmitting health-related information. And it was a first step in using communication technology to support medical care in conflict zones. Of course, from then, there was only a matter of time where evolution we had. So fast forward to the 1940s, we saw radiology transmitted over phone lines. It wasn't necessarily telemedicine, but it was a precursor to that. It was sharing of knowledge and information. And then, of course, in the 1980s and 90s, we saw telemedicine start to take a more formal shape. In war zones and remote areas, military operations and disaster response teams started to use this technology for medical imaging and remote consultations. And they could really start to see the potential of this unfold to the more advanced systems we have today. In the 1990s, the US military began to take telemedicine even one step further. Through initiatives like the Walter Reed Telemedicine Directorate, they supported tertiary care and deploying telemedicine for medical personnel and medical missions. These efforts, I think, made a really critical turning point in telemedicine, not so that it was no longer just an idea or an N of one or two, but actually an actionable tool at scale to deliver care in conflict zones. And by the early 2000s, it became even more specialized. In Bosnia, the US military used it to support even in dermatology for soldiers. It wasn't even about sharing information, it was actually about providing care. And where we are today in the 2020s, telemedicine has reached an unprecedented level of sophistication where you have automation, you have agentic AI, you have other components, and we see telemedicine exploding around the world. During the Russia-Ukraine conflict, telemedicine platforms like Doctor Online and Health Tech Without Borders and Telehelp Ukraine facilitated more than 62,000 consultations, connecting healthcare providers to patients in real time. And so there is a long history in this space, but we are building on the shoulder of giants to go even further. Now, take a step back and look at our day-to-day lives, what we do on our telephone, on our mobile devices. Technologies like WhatsApp, SMS, email, these social platforms, Facebook, etc., have proven to be invaluable in conflict zones where traditional systems are disrupted. These low-cost tools have not only been supporting healthcare professionals to share crucial information, but also raising awareness to what's happening on the ground. For example, in Syria, providers used mobile phones to share photographed copies of radiographs, to record ultrasounds on their phones, and to share those on WhatsApp to get instant feedback. They used it to enable real-time communication for ITU monitoring, and audio messages for tele-ICU that were quicker to record and text. Again, we've also seen this in Gaza, and I've been involved personally in numerous discussions on these channels. And together, both sophisticated telemedicine platforms and these accessible technologies are playing a pivotal role in ensuring continuous healthcare delivery, bridging the gap, maintaining access to care in the most challenging of environments. And I think for us, what's really important is to say, what else can we do here? And that was really about why I founded Proximie. Proximie was born on the basis that we needed really specialized digitization in these environments, i.e., a platform that enables you to connect expertise and best practices in surgery, collect data and information automatically, and activate insights to share, to help us deliver best care wherever needed. And I did that because I had spent 10 years myself in global surgery. I saw firsthand the challenges of delivering care in markets and economies and countries where this was difficult. And I wanted to move away from the in-person see one, do one, teach one to a more connected experience where you don't feel bad every time you leave, every time you're unable to travel there, that at any time you're able to share, collaborate, and deliver best practice. And so I had a vision of using familiar digital technologies to connect operating rooms and people, to leverage video streaming, AR overlay, interaction, preceptorship and proctorship. And video capture, we know, is a super important mechanism. It's why every case is streamed on Proximie. It can be recorded and stored in a Netflix-like library with up to multiple views, 4 cameras, high definition, giving you that 360 view of what's happening in that environment. And that solution can extend the reach of any surgeon and expertise to create hubs and spokes all around the world that are digitally enabled. And over the years, with use cases have evolved beyond remote collaboration to also cover training and education, workflow optimization with AI, managing and monitoring efficiency and productivity, to name a few. We changed the game by bringing surgery into the digital age. Surgery was analog for a long time, and Proximie has turned surgery into a digital, connected, data-driven environment. And we ensure that surgeons are fully prepared before they step into the OR by watching these surgical procedures in the library, having access to real-time guidance, and performing those procedures continuously with data-driven insights before, during, and post-analysis.
The operating room is more than a room. What happens there is more than procedures. The people who work there are more than staff. Lives are restored there. Tomorrow's experts learn there. Healthcare moves forward there. Today, the OR can be even more because Proximy is there. Proximy is the only operating system for intelligent operating rooms. Our technology empowers medtech companies and hospitals with real-time connectivity, unified data control, powerful development capabilities, and AI-enhanced insight. With Proximy, information flows in and out of the OR in real time. Data is captured and structured to create a single source of truth, and insight into patterns and practices are discovered. It's how to make everything that happens in the OR knowable and shareable so you can learn more, innovate faster, and optimize every minute. Keep the OR's promise to be more than a room by operating at full intelligence, only with Proximy.
So you can see how platforms like Proximy are playing a crucial role, not only in conflict zone, but also in regions that are undergoing or exposed to consistent periods of tension. In these areas, healthcare systems are often fragile. The workforce challenge is big. The possibility of future conflict is unfortunately available and there. And so telemedicine and solutions like Proximy can play a big difference. And by using these solutions, you're enhancing training and education, expanding capacity, and helping us rebuild health systems that are often vulnerable to boost and bolster their capabilities long before and after a crisis occurs. And so we need to be preemptive and proactive, collaborate with surgeons and expertise all around the world, and continue to create insights and learnings and techniques that make sure that we are ready, unfortunately, when a conflict does erupt. And our ambient and multi-angle uninterrupted views of the OR give you that experience firsthand. One of the key tools that supports the evolution of Proximy is the video library. With over 800,000 hours of recorded procedures, our library is an invaluable resource for training, for education, for complex cases, to refine your skills, even in between surgeries. And I think beyond that, we also need to understand, how do you sort of try and learn it yourself? And a key part for us was accessibility. I wanted a solution that anyone could access anywhere in the world. And so Proximy was built for that. Whether it's your phone, your tablet, your computer, Proximy will give you that experience and is future ready for anyone who wants to access it. Now, it brings me back to the story of Gaza. And this is obviously very dear to my heart. And it's unfortunate that, history repeats itself, as they say. But this is actually in 2016, where Dr. Ghassan Abu Sitta used Proximy with its telepresence and augmented reality tools to proctor and guide a case in Gaza, a hand reconstruction case for a patient that had a burns contracture and wasn't able to use their hand. And without that ability to use their hand, he couldn't be the breadwinner for his family, and he was the only surviving male in the family as well. And so by working through the case and collaborating, they were able to carry out the procedure safely and effectively. And now Fadl has a new hand. And what's exciting is that since then, he has gone on to train to become a nurse. And so we've been able to enhance decision-making and care for patients all around the world. Faster, better information, and AI insights are really the future of where we are going. It enables that quick thinking, quick training, quick access, quick ability, which is key. And it's something that I'm very passionate about because fundamentally, I believe that we need to consistently find ways to optimize productivity, optimize the workflow, and enhance capabilities wherever possible. Now, when we think about investments in this space, we need to understand that you can do ad hoc things, but what about investing in this properly and making sure that this is front and center of conflict medicine and global health, and ensuring we have these tools available all over the world. And today we're also deployed in 9 countries in Africa, where we're supporting capacity building and sustainability in clinical care. And so as I wrap up today, I want to leave you with a thought about why all of this matters. The intersection of human and resilience and technology in conflict zones is critical. Telemedicine and digital innovations are powerful tools, but the true value lies in the ability to amplify and support the courage of the healthcare workers on the ground. We know how hard it is on the front line in those environments, and enabling them and supporting those who are desperately in need of care and desperately in need of mentorship and guidance during complex decisions and complex situations is essential. Technology alone isn't enough. To truly make a lasting difference, we have to advocate to change the way we deliver things systematically, to invest in infrastructure, training, and sustained support that ensures telemedicine is not just an emergency solution, but is a reliable part of healthcare delivery. We must collectively push for policies and partnerships that put these tools in the hands of healthcare workers, empowering them to do what's best, even in the harshest of environments, but also during peacetime as well. I think we should commit to that vision. We should harness technology not only to bridge gaps in care, but to stand in solidarity with healthcare workers worldwide, ensuring that they are never left alone in their mission. Thank you.
Thank you so much, Dr. Hashas, for this insightful presentation. I will leave the floor to questions, if any. Please feel free to type in your questions in the chat box, and we'll go ahead and share it. Actually, until if they have say question and they'll be happy to join. I have a question myself. Dr. Hashash, how do you see leveraging telemedicine and this technology in formal medical education or formal healthcare education? And is there room for that? And how do you see that in training current emerging doctors, nurses, pharmacists?
I think it's absolutely critical. Actually, Proximie is deployed in over 800 hospitals around the world. And a lot of what we offer is also training and education, virtual collaboration, preceptorship, and proctorship. In my own hospital, we have it deployed in many of our rooms where nurses are using it to look back at their cases. Doctors are using it. Medical students can now dial into cases to learn about what's happening during an appendectomy, a lap chole. These are common procedures that they need to know very well, but often it's hard to get into an OR to see what's happening. So being able to have that available is key. It's almost unacceptable to have medical school programs today without a digital tool or digital component within it, when it's so available and so impactful. And we've published articles that have demonstrated that we can train twice as many doctors and nurses in half the time, and that the NPS score from medical students was that they preferred having access to a Proximie than fighting to get into an OR where they're looking behind 6 shoulders to actually see what's happening.
Absolutely, absolutely. That's very nice to hear, actually. And I think leveraging that in conflict zones is even more and more important. And for universities that are actually living through it and training healthcare practitioners within those settings. So thank you so much. I don't believe we have any question at this point. So thank you for today, and it's our pleasure. We will be sharing the recording for those who have attended. So thank you so much.
Thank you. Take care.
Bye-bye.
Bye-bye.